Okay, so I have patient Rachel Smith, female, 69 years old, full code, no known allergies, in room 3816. So she was admitted 7/23/2020. Her diagnosis is pneumonia and altered mental status. So some admission history is that she was transferred from the nursing home with decreased level of consciousness, fever, shortness of breath, and diaphoretic. Her temperature was 99.7, respirations 44, O2 sat was 85, her heart rate was 129, and EMS reported rectal temp of 103.6. Her blood pressure was stable, but she did have rattling in her chest with breathing. So she has a history of dementia, GERD, diabetes type 2, hyperlipidemia, hyperthyroidism. She was a past smoker, and she had a hysterectomy. Her doctor is Dr. Mash. So the plan is to monitor her labs. Her last lab values were her white blood cells were 23, red blood cells were 3.52, hemoglobin 10.3, glucose 147, hematocrit 31.7, platelets were 298, sodium was 134, potassium was 4.9, creatinine was 0.7, and BUN was 12. So her chest x-ray also showed consolidation and small left pleural effusion with mild emphysema. Her vitals at 1600 were 139/82. Her respirations were 18. Her O2 sats were 99 with 3 liters of oxygen nasal cannula. And her temperature is 98.5. So her neuro, she's not oriented. She does wake up with voice. So she's oriented to voice. Her pupils are equal and react to light. And she does not follow commands. Her speech is slurred. She sleeps through the day off and on and the same at night. And her daughter is at bedside. Her nasal cannula, as I said before, is set on 3 liters a minute. Her heart is normal sinus, non-penic edema, bilaterally. Cap refill is less than 2 seconds. No JVD. Mucous membranes moist and pink. Her respirations are equal chest expansion, diminished lung sounds with bronchi, worse in the upper lobes, non-productive cough, cannot use the incentive spirometer, and there is a yonker at the bedside. Her skin is warm, dry, and intact. She does have a pressure ulcer on her sacrum, and it's covered with Mepilex dressing. Her bowels are hyperactive in all 4 quadrants. There's some tenderness around her peg tube, but her skin's warm and dry, and she had a bowel movement 2 days ago. No signs of nausea and vomiting. She has continuous feeding through her peg tube in left upper quadrant, dressed with 4x4 gauze. It's clean, dry, and intact with an abdominal binder. She does not have full range of motion. Physical therapy performs in-bed exercises to prevent contractures. She's unable to assess pedal pushes and hand grips. She appears weak. She's total care bedbound. Our plan is discharge will occur with resolution of infection to nursing home, and she reports her pain as a 0 right now. So, do you have any questions for me? All right, cool.